We're all more aware than ever about the health inequalities across the globe, those unfair and avoidable differences in people's lives and outcomes within and across societies. But we also see the opportunity here for advanced digital technologies like machine learning systems, and that's leverage.
In other words, that the innovations in AI and healthcare pioneered will lead to a leap forward, delivering cost-effective solutions to early detection of cancer, or discovering that inexpensive, regulator-approved medicines could tackle preventable diseases, and so on.
I'd like to kick off the discussion by asking you first to tell us what you think AI can concretely offer people everywhere to make this significant reduction in inequities that would really be achievable in the next 3 to 5 years.
Last year when we were working on COVID-19 and developing the vaccine, one thing that was very important is to ensure that it was a global program, representative of the patients and the participants that we need to serve. And we actually developed a machine learning model in partnership with MIT. Where is the burden the highest for those that have tougher socioeconomic challenges? You reduce the burden of actually having to go to a place for a trial. So you level the playing field, as I like to call it, and you collect richer data, because it's not going to a physician and seeing them, but it's actually something that's being monitored the entire time.
I want you to imagine if your Wi-Fi box at home, imagine if that Wi-Fi signal can analyze the person breathing, heartbeat, mobility, fatigue. And just to give you one context where we use this, I worked with doctors and patients who have Parkinson's disease. But what we were able to do is, by using devices in their homes, completely touchless, monitoring their motion, the disease-relevant information, and conveying this back to the Parkinson's specialist.
So the question is, can we do the same thing that Amazon does for us when we when we're buying stuff online? It can predict what we would like to have and suggest us different things. In medicine today, we have really limited ability to foresee the future and to identify the treatment in the earliest possible stages and personalize it for a patient.
There's a statistic that comes from a study last year that of all of the artificial intelligence algorithms that are published and people are thinking about using, I think about 60 or 70% come from Cambridge, Palo Alto, and a couple of other places that have, not to diminish the health needs of people in those places, but they are not representative of the rest of the world. And so, when you're building algorithms in those places, you can only ask and answer a certain set of questions.
How do you get a result of an algorithm that can actually tells you which community needs the most urgent care? What is detrimental about this? Are you causing benefits, or sometimes we have false positive in algorithms all the time and false negatives? What are the results of using these tools? How do you take care of when things didn't actually happen the way we predicted?
And so I would like to thank everybody again, our panelists and Community Jameel and the MIT Abdul Latif Jameel Clinic for Machine Learning in Health, the Jameel Clinic, and welcome, along with Freuds. So please join me in thanking them very much for everything and a wonderful event today.